female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com slash newwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at New Webinars, and YouTube at tinyurl.com slash newwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com slash immunityviber and tinyurl.com slash immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com slash immunity-tg for Telegram. Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila. The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/MUWebReg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at MUWebinars, and YouTube at tinyurl.com/MUWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded that your details to our correct. Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Pi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022, and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com slash MUwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at MUwebinars, and YouTube at tinyurl.com slash MUwebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com slash immunityviber and tinyurl.com slash immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com slash immunity-tg for Telegram. Good morning to everyone. Welcome to today's forum. The forum will start in 15 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second, and or last Tuesday of the month from July 2021 to June 2022, and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com slash MUWebReg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com slash MuWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com slash immunityviber and tinyurl.com slash immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com slash immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at MUwebinars, and YouTube at tinyurl.com/MUwebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram. The forum will start in 5 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/MUwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at MUwebinars, and YouTube at tinyurl.com/MUwebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
Orasyo Imperata para sa proteksyon laban sa COVID-19 virus. Mahabagin at mapagmahal na Ama, nagsusumamo kami sa iyo upang hilingin ang iyong patnubay laban sa COVID-19 na nagpapahirap sa marami at kumitil na ng mga buhay. Tunghayan mo kami ng may pagmamahal at ipagadya kami ng inyong mapaghilom na kamay mula sa takot sa kamatayan at karamdaman. Itaguyod mo kami sa pag-asa at patatagin sa pananampalataya. Gabayan mo ang mga dalubhasang naatasan na tumuklas na mga lunas at paraan upang ihinto ang paglaganap nito. Nagpapasalamat kami sa mga bakunang naisulong sa patnubay ng iyong mga kamay. Pagpalain mo ang aming mga pagsisikap na mawakasan ng mga bakuna ang pandemya sa aming bayan. Patnubayan mo ang mga lumilingap sa may sakit upang ang kanilang pagkalinga ay malaki pa ng husay at malasakit. Pagkalooban mo sila ng kalusugan sa isip at katawan, katatagan sa kanilang paninindigang maglingkod at ipagsanggalang sa karamdaman. Itinataas namin ang mga nagdurusa. Makamtan nawa nila ang mabuting kalusugan. Lingapin mo rin ang mga kumakalinga sa kanila. Pagkamitin mo ng kapayapaang walang hanggan ang mga pumanaw na. Pagkalooban mo kami ng biyaya na magtulong-tulong tungo sa ikabubuti ng lahat. Pukawin sa amin ang pagmamalasakit sa mga nangangailangan. Sa pagdamay at malasakit namin sa bawat isa, malampasan nawa namin ang krisis na ito at lumago sa kabanalan at pagbabalik loob sa iyo. Hinihiling namin ito sa pamamagitan ni Hesukristo na nabubuhay at naghaharing kasama mo at ng Espiritu Santo, Diyos magpasawalang hanggan. Amen. Tumudulog kami sa iyong patnubay, mahal na Ina ng Diyos. Pakinggan mo ang aming mga kahilingan sa aming pangangailangan at ipag-adya mo kami sa lahat ng kasamaan, maluwalhati at pinagbalang Birhen. Amen. Mahal na Birhen, mapagpagaling sa may sakit, ipanalangin mo kami. San Jose, ipanalangin mo kami. San Rafael Arcangel, ipanalangin mo kami. San Roque, ipanalangin mo kami. San Lorenzo Ruiz, ipanalangin mo kami. San Pedro Calungsod, ipanalangin mo kami.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM live stream.
The title of this forum is HPV Gone Viral, The Male Connection, or HPV Gone Viral, ang Ugnayan sa Kalalakihan. Today's forum aims to give us insights on the details of HPV infection and disease among men. For today's forum, we have Dr. Maria Rowena del Rosario Raymundo, the Vice Chancellor for Academic Affairs, OIC, and Associate Professor of UP Open University, Subspecialist in Infectious Disease and Consultant of San Pablo College's Medical Center, as our moderator.
Happy holidays to all our viewers, and welcome again to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, Mu Sigma Phi Foundation, UP College of Medicine, Philippine General Hospital, and the City of Manila. This forum is a series of panel discussions that discuss common concerns of women from all ages and walks of life. However, today, on the ninth leg of the year-round webinar and the last episode of our HPV infection series. Our episode is going to be quite special because, as you will see later, although the issues still tangentially involve women, we will see the impact of HPV on the male population. If you have any questions for our speakers later, you may type them into the Q&A boxes of the UP Manila live stream and Zoom, or the chat boxes of Facebook Live and YouTube. Our webinar today is entitled HPV Gone Viral, the Male Connection. It aims to introduce us to the details of HPV infection and disease among the male population, its burden of disease, risk factors, manifestations, diagnostic options, treatment, and prevention. So to formally start the webinar, I am honored to introduce our speakers. Our resource persons are both alumni of the UP College of Medicine, class of 2001, and distinguished surgeons in their respective fields. We have Dr. Art Castro Jr., a urologist, and Dr. Archie Cabungcal, a head and neck specialist. Our first speaker is Dr. Arturo P. Castro Jr., or Dr. Art. He had his residency training in general surgery at the Philippine General Hospital, after which he did subspecialty training in urology at the National Kidney and Transplant Institute. Since then, he has been an active consultant in different institutions, such as the Manila Medical Center, St. Luke's Medical Center, Quezon City, National Kidney and Transplant Institute, Asian Hospital and Medical Center, and the Medical City or Diaz. Aside from these, he is also the current head of the Kidney and Prostate Center of the Medical City, South Luzon. Let us now welcome Dr. Art Castro Jr. of the Mu Sigma Phi Fraternity, Batch 2001. Dr. Art?
Thank you very much for your kind introduction, Doktora Wen. Let me share my screen. Are you able to see my screen now? Not sure if you were able to see my screen.
Not yet, Doc Art.
Not yet.
Maybe hindi pa.
Hindi pa.
There you go. You're starting to see it na. Yeah, it's loading.
Okay.
It's starting to load. Beautiful colors on the screen. Nandun pa lang. Naglo-load. Naglo-load siya.
How about that?
There you go. Human papillomavirus in males. You're good to go.
Okay. Thank you very much.
But I think, Doc Art, siguro dapat present, what do you call this? Presenter view. Yata ang nakikita namin. Siguro dapat,
How about that? Is it still in the presenter view?
Now, nawala siya. Now we can see you again, pero nawala yung presentation.
Okay. Let me just reload it again.
Starting to load. Slideshow na. Yan. Okay. Good to go.
Okay. Thank you very much for this opportunity to share my knowledge about the human papillomavirus and its effects on the infection in males. Thank you very much to the Mu Sigma Phi sorority for inviting me. It is a pleasure to do this for my CISES. So, good morning. We will talk about the human papillomavirus. It's a small double-stranded DNA virus, but it's small and terrible, no? Small but terrible. It's the most commonly sexually transmitted infection in the United States. It's estimated that annually there's 6.2 million new infections. 50% of sexually active males will be infected in their lifetime, and 80% of sexually active females will be infected by the age of 50. There are more than 200 types of this virus. Of the 200, 40 have a predilection to the anogenital mucosa. So the cutaneous types, these are the common warts. They can manifest as common, plantar, or flat warts. No? They're usually caused by types 11 and 6 of the HPV. Then we have the mucosal HPV, which actually have, which usually causes cancer in the anogenital area. No? The high-risk types of virus are the type 16 and 18. So this human papilloma virus infection causes significant financial burden. No? It's estimated that a single episode of genital wart infection cost $460 to treat. But here in the Philippines, it's something in the range of 30,000 pesos. Because if you do topical treatment, like with imiquimod, the sachet would cost around 750 pesos, and you have to use it about 3 times a week for as long as about 16 weeks. So that's a really prohibitive cost, no, for a regular Filipino person. In the US, since it's so widespread, the annual healthcare cost is approximately $210 million. Long-term sequelae in males include perianal warts and anal cancer and penile cancer, of course. It is most prevalent in males who have sex with males, no? Especially those who are HIV positive. So the treatment of the genital warts include the following: topical treatment like imiquimod and podophyllin, cryotherapy, trichloroacetic acid, surgical excision or electrocautery, and intralesional interferon therapy, as well as laser ablation. Now, if it develops into penile cancer is not that common, by the way. It's actually rather rare disease entity, but it's usually caused by HPV type 16. So when we see patients who have really fungating lesions of the glans penis, then we have no choice but to surgically excise that area in order to prevent the spread of the malignancy into other parts of the body. No? So if it's quite early and it just involves the tip of the glans, then we can do partial penectomy, as you can see in this slide. This is the end product, no? End result of that surgery, partial penectomy, in which the glans penis has been excised and the corpora has been reconstructed, and there's a flap of skin that was overlaid on it. But in cases of severe, no, or advanced penile cancer, then we have no choice but to do a total penectomy. Here we have to really remove the entire penis, and then we have to recreate the exit for the urine. So unfortunately the man will be forced to urinate sitting down for the rest of his life. So, but I think that's just a small price to pay for extension of his life. No? The risk of developing HPV infection in males include the following factors: no? Sexual promiscuity, early sexual debut. They say if the first sexual experience happened below the age of 21, then there's a higher risk of HPV infection. the absence of circumcision, because uncircumcised male have more areas for the HPV virus to attach to. In fact, there has been studies in which it has been documented that HPV infection in uncircumcised males clear longer. No? It takes a longer time to clear compared to those who are circumcised. Lack of condom use, as we all know, because transmission is based on a skin-to-skin contact. So barrier methods, to some extent, protect from being infected from HPV. Smoking is also a risk factor. Manifestations of HPV in males. So mostly, most males who are infected with HPV are asymptomatic, and it is said that infection resolves within 1 year. There's a study that said that on average, infection would be gone at a median time of about 7.5 months. But not all infections clear up, because HPV can become latent. No? It can stay dormant within the person's body. So Condylonia acuminata, this is the warts, genital warts. They vary in size, shape, and color. They develop about 3 to 4 months after the contact or the exposure. They usually are asymptomatic. They don't itch, they don't bleed, and they're not painful. But they're not good to look at. No? They're unsightly. But sometimes they do have symptoms like itching, burning, pain, and tenderness can occur. So diagnosis, there's no current test for HPV infection in men. In the US, there's no FDA-approved kit to test HPV infection in men. The diagnosis of HPV in men is made when external genital warts are seen. So since there's no treatment for HPV that has no symptoms, most men with the infection are not treated. So prevention of HPV in men include the following: vaccination, sexual abstinence, and of course, trying to refrain from having sex at a very young age, and limitation of sexual partners, use of condoms, circumcision lowers the risk, and a healthy lifestyle for a stronger immune system. Here we have estimates of the incidence of HPV infections in the Philippines. This came from the International Journal of Cancer in 2017, in which Del Martel et al. Documented the actual estimates for year 2012 in the Philippines. So 16 out of 100,000 women during that time were documented to have cervical infection of HPV. And about 1 in 200,000 women had anogenital infections of HPV, and about the same, or 1 in 500,000 women had infection of oropharyngeal oral cavity or larynx of HPV. Anal cancer can develop also with the types 16 and 18. It's rare in the general population worldwide. It's just about 1 in 100,000 population, but it's increasing in developed countries. The global estimates about 27,000 new cases every year. Women have higher incidences of anal cancer compared to men, but this is the opposite when it comes to men who have sex with men, who have receptive anal sex. They have a higher prevalence of anal cancer compared to women. So here's another statistics that was presented. It came from the Agency for Research on Cancer, in which they documented the incidence of cancer in Manila and the Rizal areas for the periods of 2008 to 2012. I think this is per 100,000 of the population. So penile cancer, another disease that comes from HPV infection, especially of the type 16. It's a rare cancer, but it's strongly correlates with cervical cancer, with about 22,000 cases worldwide annually. So it most commonly affects males at the age of 50 to 70 years old. The incidence rate is higher in less developed countries. No? Actually, it's very high in African nations. No? Not so in Europe and America, but there are also some in Asia. So there are also precursor lesions like carcinoma in situ of the penis. So 95% of these cancers are squamous cell, and it's commonly detected to have basaloid and warty tumors. So 60 to 100% of precancerous lesions are positive with HPV DNA. So here's the data for Manila and the Rizal areas for 2008 to 2012. There's about 38 cases per 100,000 population during that time period. So with regards to prevention of HPV infection, there are 3 kinds of vaccines now available in the market. There's a bivalent vaccine, Cervarix, and there's a quadrivalent vaccine that protects for 4 kinds of virus, the Gardasil, and there's a 9-valent vaccine which protects for 9 types of the HPV. So the vaccine schedule, as advised by the U.S. Advisory Committee on Immunization, recommends that it should be given for 2 sexually naive males and females. The recommendation is to start at around 11 years old, but it can be started as early as 9. And then catch-up vaccination can be done for the population of 13 to 26 years old. For more than 27, it's not routinely recommended, but it can be an individual decision, a basis on the individual's decision. So some individuals on this age group may have some advantage having the vaccine, no? Especially those who have no prior sexual experience, with the limited number of sexual partners, and the risk of HPV exposure is very low. And also it's all offered to health workers. In fact, surgeons who are handling wart removal, like urologists who cauterize warts in the operating room, the smoke actually contains viral particles that are active, no? That can still induce infection. So even if you are more than 26 years old and you're a health worker with high risk to exposure to HPV, then vaccination will provide you some protection. So HPV vaccine in the US is approved only up to the age of 45. Thank you for your attention.
Thank you very much for that very informative talk, Doc Art. I'm sure marami natutunan ng ating audience from your talk, and I'm also sure that it's a cause for concern for many who may not have been aware of this disease condition, especially after learning of the consequences. Pwede siyang benign warts, pero pwede rin cancer. Now, to further enlighten us on this topic, let us now welcome our second speaker, Dr. Arsenio Claro A. Cabungcal. Doc Archie is also an acclaimed alumnus of UP College of Medicine class of 2001. After taking his residency in otorhinolaryngology at PGH, he pursued his fellowship in head and neck surgical oncology in PGH and Erasmus University Medical Center in the Netherlands, where he also subspecialized in endonasal endoscopic skull-based surgery. Currently, he is an active consultant in PGH and the chair of the Academy of Head and Neck Oncologists in the Philippines. Doc Archie is also active in the academe as an associate professor and residency training officer in the Department of Otolaryngology, Head and Neck Surgery in UP College of Medicine. Please join me in welcoming Dr. Archie Cabungcal, UPCM Class 2001.
Hi everyone, I am Dr. Arsenio Claro A. Cabungcal from the UP College of Medicine, Philippine General Hospital Department of Otolaryngology, Head and Neck Surgery. I have been teaching students and residents for the past 12 years, and for today, I will be talking about HPV in the head and neck. The human papillomavirus, or HPV, is a sexually transmitted disease, and many people will most of the time associate this infection with the sex organs, the penis, and the vagina. However, we won't be talking about that here, as that has been discussed or will be discussed by my batchmate and blockmate Dr. Art Castro. And yes, aside from the head down there for males, the true head and neck can get infected with HPV as well. So, such infections can have long-term serious sequelae, as you will find out later on. HPV can infect the mucosa or lining of the oral cavity of the mouth and throat. This is transmitted through oral sex from an infected person. Multiple sexual partners increases one's risk of getting infected. HPV is estimated to be present in 10 out of 100 males and around 4 out of 100 females. In the United States, HPV is the most common sexually transmitted infection. Many people are exposed to the oral HPV in their life, but most people clear HPV infections within 1 or 2 years. But in some, HPV infections persist, and there lies the problem. What about the incidence of HPV in the country? Data on this is lacking, but looking at the crude incidence rates of HPV-related head and neck cancer, particularly in the oropharynx, as reported by IARC Information Center on HPV and cancer, the numbers are quite small, a lot lower than cervical cancer-related HPV infections. A local study done at Mariano Marcos Medical Center in Ilocos on head and neck cancers and HPV showed that out of 163 patients, none turned out positive for HPV for the oropharyngeal cancers. Only 3 laryngeal cancer patients were positive for HPV infection, but these were the HPV 11 variety and not the HPV 16 type. Worldwide, the number of HPV infections and HPV positive oropharyngeal cancers has been steadily increasing, and quite at a rapid rate. HPV prevalence in 1984 to 1989 was just at 16%, but this jumped to almost 72% by 2000 to 2004. That increase in HPV infections also coincided with a 225% increase in incidence of HPV positive oropharyngeal cancers. Looking at the overall HPV prevalence in oropharyngeal cancers, this increased from 40.5% before 2000 to 64.3% between 2000 to 2004, and even went higher in 2005 to 2009 to as high as 72.2%. Latest data in the US is showing that approximately 70 to 90% of newly diagnosed oropharyngeal squamous cell carcinomas are HPV positive. Why is HPV significant in the head and neck? It is because it can cause cancer, particularly cancers in the oropharynx. The oropharynx is an area in the head and neck located at the back of the tongue, more commonly referred to as the throat by lay people. Structures in the oropharynx are the base of the tongue, the soft palate, and the tonsils. The tonsils are the most common to develop cancers related to HPV infections. Cancers in the head and neck have a propensity to metastasize into the neck nodes, and as such, some patients notice this first and prompts them to seek consult, and that primary cancer is in the oropharynx is then detected only at the time of consult on further examination and endoscopy of the ORL-HNS physician. For oropharyngeal cancers, neck node metastasis is noted to be highest at level 2 area at 71%. You might be wondering, will I get oropharyngeal cancers when I get infected with HPV? The answer is not always, and if ever, it takes years, at least 15 years, to develop cancers from an HPV infection. Almost all of these cancers are caused by HPV 16, a subtype of the HPV virus. Research indicates that approximately 70% of cases of oropharyngeal cancers are caused by HPV 16. How does this HPV-16 cause cancer? HPV infections in the oral cavity and oropharyngeal mucosa is usually cleared in 1 to 2 years. If this does not happen and the infection persists, this can induce HPV-related oropharyngeal squamous cell carcinomas. On the molecular level, HPV E7 and HPV E6 proteins inactivates tumor suppressor proteins such as your retinoblastoma protein and p53 protein. This promotes genetic instability and development of cancer by allowing the squamous cells to replicate continuously without any regulatory mechanism, as such resulting in continuous growth as cancer. Because of the degradation of this retinoblastoma protein, this induces an overexpression of more p16 protein. That p16 protein then is the immunohistochemistry stain used to stain the specimen to determine HPV positivity. It is an established surrogate biomarker. You might be wondering what is the fuss about all these HPV and oropharyngeal cancers. Isn't it just the same as your non-HPV oropharyngeal cancers? The answer is they're different. The outcomes are different between the two. HPV positive oropharyngeal cancers have better treatment outcomes or better treatment responses and outcomes compared to non-HPV oropharyngeal cancers. Now, looking at treatment for oropharyngeal cancers, does having HPV in oropharyngeal squamous cell cancers change the treatment or chances of being cured? Both types of cancers are treated the same way. But people with head and neck cancers caused by HPV respond to treatment better than people who do not have cancer caused by HPV. Researchers now are studying whether cancer treatments should change when HPV is involved. Treatment for oropharyngeal cancers as a whole yields high cure rates, but this standard combined modality treatment carries with it acute and long-term toxicities that can be challenging to patients. As such, researchers now are looking at de-intensification of treatment. Can we do the resections through minimally invasive approaches, such as your transoral surgeries and using robots where available? Can we reduce the RT dose to below 60 gray instead of the 70 gray and get the same survival outcomes but with less treatment side effects? Less intense treatment equals less morbidities and better patient comfort and satisfaction. Current data is pointing towards this. What then is the long-term prognosis for people with HPV-positive throat cancers? While the prevalence of throat cancers derived from HPV is steadily increasing, data suggests that it responds better to treatment. Patients with HPV-positive throat cancers have a disease-free survival rate of 85 to 90% over 5 years. This is in contrast to the traditional patient population of excessive smokers and drinkers with advanced disease who have a 5-year survival rate of a measly 25 to 40% over 5 years. Thus far, we have talked about HPV causing oropharyngeal squamous cell carcinomas. And you may be asking yourself from the start of all of this, can vaccination prevent this, similar to vaccination to prevent cervical cancer? HPV vaccination has long been promoted to prevent cervical cancer. As such, it is mostly associated with vaccination in females. However, males can get the vaccine as well. This vaccine is best given before a person begins their active sexual life, during adolescence probably. In 2020, the US FDA has expanded the indication for HPV vaccinations to include prevention of HPV infections and oropharyngeal squamous cell carcinomas. Aside from vaccination to lower the risk of developing oropharyngeal squamous cell carcinomas from an HPV infection, other ways are the use of condoms and dental dams. When used consistently and correctly, condoms and dental dams can lower the chance that HPV is passed on from one person to another. Also, part of prevention is to minimize or avoid sexual promiscuity, multiple sexual partners. And as already mentioned, vaccination. Have you ever wondered what a dental dam is? It's quite unlikely to put one in the mood and probably is a good reason why it works. One would most likely rather just have a beer than use this. So that's it. In summary, the head and neck can get infected with HPV, Oropharyngeal squamous cell carcinomas are increasingly being caused by HPV, and the silver lining in all of this is that it is more responsive to treatment and thus better outcomes. Prevention, though, is still the key to avoid developing oropharyngeal cancers caused by HPV. Thank you very much.
Thank you. That was very, very interesting, Doc Archie. Tama nga naman na even if HPV is usually thought of as a sexually transmitted disease, hindi lang naman laging lower head ang involved. Maaring literally head and neck ang involved and in the form of oropharyngeal cancers. So that's something to think about. And you may have noticed that today's topic gave us a very different perspective on HPV infection. And learning how HPV infection could manifest among the males is indeed very helpful for us. So we can convince and urge our male partners, brothers, and colleagues to get checked and consider vaccination. Now, I know at this point, everyone is so eager to ask their questions and share their opinions. But first, let's hear from our guest reactor to also give some of his insights, no, on today's talks. And we have here with us today an award-winning food and travel blogger. He's the founder of our awesome planet, Mr. Anton Diaz. Mr. Diaz has been a digital creator and video storyteller since 2005. And since he decided to pursue professional blogging in 2008, he has received a lot of support for his personal blog and digital channels, our awesome planet. So it's like a continuing autobiography of his family's food and travel adventures. And it also serves as his love letter to his 4 wonderful sons. During the pandemic, he launched and co-founded Awesome 10x Global, or 10 times, Global Stock Investing and Crypto Education to help Filipinos 10 times their savings in 10 years, multiplied by 10 times. Aside from his blog, Mr. Diaz is also a digital transformation coach where he provides digital marketing masterclasses to individuals as well as companies. So now please join me in welcoming Mr. Anton Diaz. Anton?
All right. Thank you, Dr. Wen, for the introduction. And thank you, Doc Art Castro and Doc Archie Cabungcal for the awesome presentation. Now, it's the first time actually I'm learning about the human papilloma virus and how it affects us men. Kasi I thought it was really for women. Actually, during the series, akala ko it only affects cervical cancer. And yung pala, you know, men would have impact. It would impact us. It could impact us with anal cancer, penile cancer, and oropharyngeal cancer. No, so nakakatakot yung mga pictures actually. And the thing is, though, among men, this is a hush-hush topic. Actually, nobody's discussing this, diba? Hush-hush yan, and I'm sure. This is the first time I heard about HPV for men. And thank you to Mu Sigma Phi Sorority for this webinar, Gone Viral, the Male Connection webinar. So I want to share with you like 5 of the learnings that I took notes from the talk. First, I realized it's really hard to detect from men. And as Dr. Art was saying, there's no testing because mostly are asymptomatic, diba? Unless the genital warts manifest themselves after the exposure. Nakakatakot rin yung statistics na 50% of male population that are sexually active will get HPV during their lifetime. So it's really a concern, no? Mahirap mo siya ma-detect, tapos you'll get it pa in your lifetime. Second, I think like in any disease, prevention is the key, no? With monogamous sexual relationship, use of condom, and vaccination before men become sexually active. So at least that was very clear in the presentation. But of course, with the Catholic teaching, the best pa din is not to have premarital sex before marriage and just to stick one partner. Third, I think this is another big issue in the modern generation. No? The bigger risk of nauso na yung term na MSM, no? Men having sex with men. Aside from, actually, I had another there was a play on HIV naman, how HIV is increasing actually in the Philippines. So not only HIV, but we're also dealing with HPV, no, especially for those doing MSM, no, men having sex with men. So, and another hash topic, nobody discusses it among parents. Parang walang nagdi-discuss. And thank you for bringing that to the forefront of the discussion. Number 4, ito, actually, I know it's lunchtime and we had gruesome pictures of, the penis being cut. Showing pictures actually HPV on the penile part is very effective. And the risk of cutting it off when you have cancer can motivate people to act and be vaccinated. Especially for us, we have 4 kids, no? And so inisip ko na sila, I don't want them to get HPV during their lifetime. No? And the 3 of them are actually approaching adolescent years. And before they become sexually active, promising at least, no, you can get vaccine. And my understanding is lifetime protection if you get it before sexually active. So that's actually promising, at least for the kids, no, as they get into adolescent years. Now, one concerning fact also, and that's why bukas yung isip ko dito sa topic na to, kasi alam mo, there's a trend in other parts na there's increasing sexual activity after the pandemic, no? As we get more face-to-face interaction. Imagine mo, di ba? Dadami yan. You know, the risk of HPV is very crucial, no? Aside from COVID, it's HPV. And thank you for bringing this upfront kasi a lot of people just talk about COVID. So, with this, actually, ang dami kong tanong in my head, and I'm sure most of the parents would have these questions on their head to get to know more about this. I'll probably share some of the questions and maybe Dr. Art or Dr. Archie can answer them. But something on my mind after looking at the presentation. First, like COVID, ano ba yung mga different variants? I think in the presentation, you get familiar with HPV 16. Yan yung pinaka, at least for men, no? Parang tumatak sa isip ko, HPV 16. And ano ba yung vaccine that affect HPV 16? Syempre, may probably particular vaccine that affect that. And I want that for my kids, no? So my kids are 12, 14, and 16. Pwede na ba yun to get HPV vaccine? How young? Based on the trials, pwedeng i-take yun? Pwede bang coincide with the COVID vaccine? I'm sure pwede naman siguro. When can we get it? The women have OB-GYN. I guess the men does not have a urologist until probably later stage of their life, di ba? I guess, I don't know, OB-GYN rin ba or of the OBGYN of the mother, pwede ba mag-administer ng HPV, no? And then, how many doses? Magkano ba yung budget? So, I'm sure a lot of families are thinking about, ano bang budget yan? 24,000 ba yan? How much per dose? And then, once you confirm HPV, paano bang protocol? May protocol ba yan, Doc, na kailangan mo i-disclose dun sa sexual partners or to the parents if they're kids? Kasi it's very concerning din, di ba? If nobody discloses it, paano ba yun? What's the proper way to do it? And practically, lastly, yung education of the kids. Siguro nga, inisip ko, baka meron bang shorten, parang presentation, like 5 slides presentation we can present to our kids. Especially kami, we're boys kasi. So, maybe one picture of what's penile cancer, ano yung HPV, parang ganun, para we can teach our kids. Yun lang, ang dami, a lot of things going on in my mind, and thank you for this webinar. At least, we're starting to discuss it with my wife, Rach. Paano ba natin gagawin to, di ba? Paano yung budget? When's the right time to do it? Before all this pandemic is over, di ba? We probably have to do HPV vaccine. Yun.
Okay, thank you, Anton, and very, very, very valid learnings, observations, and insights. Una muna, just to recap, no, Anton mentioned different 5 points, like hush-hush ang topic, hindi siya ganun ka well-known. There's a Catholic or a religious aspect. Then there's issue about men having sex with men. And there's also this, the effect of those graphic photos, no? Actually, kaya nga in the past webinars, kasi lunchtime, we've been saying pasintabi po sa mga kumakain. But, it really creates an impact, no? Like Anton said. And there's also, that aspect of yung ano ba yung effect kapag syempre yung increased sexual activity sa pandemic, di ba? And dami-daming observations. And he also had a lot of questions. So now at this point, we'd like to invite again our speakers, Doc Art and Dr. Archie. So everyone is eager to ask the questions, and we'll start to unpack Anton's questions and also those of the audience. So reminder, as we start our Q&A, again, for the audience, you may type your questions in the Q&A boxes of UP Manila live stream and Zoom, and the chat boxes of FB Live and YouTube. Okay, so Doc Art, Doc Archie, let's unpack Anton's questions. Unang-una, umpisa kaya tayo dun sa unang tanong ni Anton kanina. Ano ba yung different variants of HPV virus that can affect men? And ito ba ay ibig ba sabihin nito, iba-iba rin yung vaccine na dapat ibigay sa men and women o pareho lang? Who would like to answer that question? What are the variants? Kasi HPV 16 was discussed kanina. But what else? What variants can affect men? Sinong gustong mag-start?
I think I can start answering the questions.
Doc Art.
But both of us, Archie and I, can actually address the question. Thank you very much for your very insightful comments, Sir Anton. Galing nung mga naisip mong itanong. Really very practical application, no? As a parent and as a layman. Anyway, so yung ano ba yung mga types? Basically, ang mga notorious dyan, yung type 16 and 18, because these are the types that cause most cancers, no? Cervical, vulvar, vaginal, penile, anal cancer, oropharyngeal. These are the two types na talagang Bonnie and Clyde, no? Sila yung notorious causing those cancers. Sabi nga ni Archie, 70%, no, of oropharyngeal cancer are caused by HPV 16. So for anogenital naman, 90% caused by 16 and 18. So yun yung pinaka-notorious. But meron namang mga types na yun yung mga causing benign warts lang, no? These are types 6 and 11. So 90% of benign warts are caused by types 6 and 11. For mga oncogenetic types, there are actually about 15 types of the HPV that causes cancer. So with regards to yung question mo on vaccines, there are 3 vaccines available in the market right now. 4 if you count yung sinasabi nilang available sa China, na sa China lang ginagamit. So parang meron silang Sinovac version, pero hindi siya approved outside of China. But basically, we have Cervarix, which is a bivalent vaccine. It's a vaccine that protects patients to type 16 and 18. So basically, yung cancerous type lang ang pinoprotektahan niya. And then, yung Gardasil, dalawang types of Gardasil vaccines are available. Yung quadrivalent protects against 4 types of HPV, no? Yung dalawang Bonnie and Clyde, 16 and 18, that causes cancer, and then the 11 and 6 that causes the benign warts. Tapos yun naman pinakabago in the market right now, which in the US, yun na lang ngayon ang ino-offer nila, yung 9-valent Gardasil vaccine, which protects against 9 types of HPV. So basically, if you talk about alin ba ang pwede sa lalaki dyan, lahat yan pwede sa lalaki. Ngayon, kung gusto mo, dapat piliin mo yung mas pinakamaraming maproprotektahan ka, which is yung 9-valent of the HPV na pwede kang protektahan against. But kung yung budget ang pag-uusapan, syempre, the more virus types you are protected against, the more expensive. Cost around mga 3,000 per shot. And then yung ating quadrivalent na Gardasil, I think ballpark figure baka nasa 6 or 7 yan per shot, no? And then yung 9-valent vaccine is about 10 per shot. Ngayon, pagka bata pa, no, sexually naive, sabi nga nila, it can be given as early as 9 years old, 2 shots lang ang kailangan. First shot and then 6 months later, another shot. Pero if you're talking about yung mga ages 16 to 26, dapat mga 3 shots yung ibibigay, no? Over a 6-month period. Yung at the first shot, 2 months later, your second shot, and then 4 months after your second shot. So basically, if you use the 9-valent vaccine, it would cost you around 30,000 pesos per patient. So yun yung most expensive. I think si Arch naman, if he has some take on this.
Yeah, Art, actually, thank you for answering that question. To be honest with you, if you look at the report that I made, it was only in 2020 that that vaccination, HPV vaccination for oropharyngeal cancers, were just approved in 2020. So we're looking at doing the vaccination siguro in the next few years. But for the past few years, we haven't been giving vaccines as ORL HNS physicians to prevent oropharyngeal cancers. So mas nagva-vaccinate siguro si Art at saka si Ma'am, si Dr. Raymundo. But kami at this point in time, not yet. But we're looking at doing more vaccinations in the future. Also, I'd like to mention, possible din kasi may cultural effects din, yung infection rates. One of the questions is, totoo bang mataas ang oropharyngeal carcinoma related HPV infections in the country? In abroad kasi baka mas mataas, mas madalas sila mag-oral sex, but dito sa atin, it might be taboo for some people. So the sexual practices might be different, and that might affect the incidences and prevalence of such infections. And I think that's an area that we need to look at in the near future.
Yeah, that's a very good point you raised. Kasi, di ba, iisipin ng tao di ba, head and neck, and then, di ba? So, it must be clear to people. Like, na-raise ni Anton kanina, di ba? An increase in sexual activity, sexual practices, ganyan. Kasi, syempre, you really have to discuss the practice of oral sex. Kasi in relation to how it can get transmitted to, di ba? How can it reach the head and neck area when it's a genital infection. So, that was a very good point na you raised. What about, Anton has sons, di ba? All sons ka, Anton?
Yes,
Oh. So medyo pero malaking implication yan. So what can you say about, kasi hindi ba nga, like you said, most of the HPV vaccination initiatives have been addressed to women, di ba? So what if a patient approaches you? Like Anton, bilang ama, syempre concerned, kasi syempre mga boys, di ba? Na it may not be that common, pero should I have my boys vaccinated at this age? How would you advise parents who approach you with boys in mind, boys? They want to have their preteens vaccinated after seeing all those graphic photos that syempre ayaw mo magkaroon ng ganun, di ba? For both benign and it may lead to cancer. So Doc Art or Doc Archie, would you like to give your thoughts on that?
Una ako, Art. Una ako
Okay.
this time. Yeah. I think we should start promoting, since it's already been approved and recommended by the US FDA. We should start promoting it. But then again, we should have our own local data. So we should start collecting our local data on, especially for oropharyngeal cancers. There was one study pa lang in the country, and this was done in the province in Ilocos. And out of 168 patients, they didn't see any HPV. 3 lang ang nakita nilang HPV positive. It wasn't even HPV 16, which is related to cancer. And it wasn't even in the oropharynx. So part of their discussion there was, kailangan natin tingnan yung sexual practices natin, aside from just checking the HPV variants. No? That's in the province, and they also recommend that we should also look at it and differentiate and assess what are the sexual practices in the metropolis, in urbanized centers. Baka kasi different mas accepted ang oral sex sa urbanized centers, and that might cause increases in incidence of HPV. And eventually, pag naging latent and prolonged the infection, that can cause oropharyngeal cancers. Yep, I would recommend getting vaccinations, but at the same time, parallel to that is we should also start studying and evaluating and doing research on incidences and prevalence of HPV infections in the oral pharynx.
Yeah, I agree with that. Anton, you had a question kanina, di ba? Yung sabi mo, once you confirm you have
Oo,
once
paano ba
you
yun?
have protocol, o you
Oo.
can ask that. Ano yung sa
May
protocol?
protocol ba yun? Oo. Once you've confirmed you have HPV, or wala, hash-hash pa rin yan usually. Or you note sino ba yung mga sexual partners ng mga anak mo and then tell their parents, or you tell, paano ba? What's a proper way to do it?
Would like to answer that.
When I see my patients in the clinic and they come to me regarding, sexually transmitted diseases, not just about, condyloma acuminatum or genital warts, I always tell them to be responsible and inform their partners. But yung mga evaluation ko naman ng patients who come in to be evaluated for genital warts or HPV infection, sometimes they come from fellow doctors, OB-GYNs, na yung mga wives have been detected to have HPV infection. So pinapadala yung boyfriend o yung husband sa clinic ko for evaluation. I examine them. Siguro mga 70% are asymptomatic, no? Wala silang kahit anong wart, but their wives or partners are infected. So baliktad naman. Alam na natin na positive na yung girl. So I always tell them na may benefit pa rin na magpa-vaccinate because we don't know which type of virus infected them. And for the types that has not infected them, the vaccination will afford them some protection. But I always make it clear that this is not a therapeutic vaccine. No, it is not a vaccine that will cure you of the infection. But it is a vaccine, just like any vaccine, that will protect you from further infection from the types that you are not infected with to start with. So
follow up lang dyan, Doc Art. So once you get the HPV, nasa system mo na yun, forever na yun?
Merong mga documentation na it is cleared from the body within, sabi nga nila, a median period of 7.5 months or an average of, sabi ni Archie, 1 to 2 years. No?
Pwede
But
mawala.
it can stay latent. Ibig sabihin, there are studies that have documented that the virus has stayed well beyond 10 years after being infected. So pwedeng it can stay within your system.
And then nakakahawa yan kahit kahit latent siya?
Yes, asymptomatic carriers are infectious.
Wow.
So they can still transmit it through body contact, no?
Yeah, that's the scary part. Kasi the HPV lives sa squamous cells, di ba? Kaya kahit hindi penetrative na sexual intercourse, di ba sinasabi nila to avoid STIs or sexually transmitted infections, wag na lang mag-penetrate. Pero actually, skin-to-skin contact, pwede yun, no? Tapos, ang isa pa yung importanteng dapat na maalala is yung nagka-cause ng, di ba merong high-risk types that cause high-risk types associated with the cancers. Like sabi nga, HPV 16, saka 18. Pero meron din naman yung mga sinasabing non-cancerous types like 6 and 11 which cause papilloma, yung mga genital warts, gano'n. It's actually the persistence of the high-risk types. Kaya kunyari, nalaman mo na may high-risk type ka, di syempre kakabahan ka kasi kung magkaka-cancer na ba ako. Actually, many of these clear. It depends on the body's immune system. So kahit pa high-risk type yan, the body has the capacity to clear it. So hindi yung mismong presence lang ng high risk. It's the persistence. And there are some people who, for some reason, hindi nila ma-clear and it persists. Yung sinasabi mo na it stays with them for a long time. Kaya, di ba, sabi nga ng speakers natin, ang tagal it takes time before mag-develop into cancers, di ba? So nakakatakot talaga, dapat mag-vaccine. Covered ba ito ng Medicare? May tanong si Art kanina, si Anton. Covered ba ito ng Medicare or HMOs?
Or
Did you know? Or
alam ko hindi. When it comes to vaccinating my patients, wala pa akong na-encounter na nagsabing may HMO can cover it. So alam ko hindi.
Question for Doc Archie. Bakit na-explain mo kanina, di ba? Parang mas maganda yung prognosis or outcome pag HPV related
Positive.
yung cancer. Oo, positive. Oo. As opposed to yung mga non-HPV. Why is it like that kaya?
Ma'am, kasi they're looking at it like with smoking, the chemicals, they call it a field cancerization. So when you smoke, lahat yan na change ng chemicals ng smoking, ng nicotine and cigarette, yung genetic makeup ng cells mo all over kung saan dumadaan yung smoke, no? Including the nose, the throat, and up to the lungs. When it comes to HPV, it's kind of focused, no? So less field cancerization yun yung nakita nila. And also yung P53, which is a regulatory protein to prevent, prevent na hindi nakokontrol yung cells. Kasi pag hindi nakontrol yung cells, magmumultiply siya na magmumultiply. Manganganak siya manganganak and causes that tumor. So sa HPV daw, mas maganda yung recovery ng P53 during treatment. So yung katawan mo, aside from the medicines that are given, the chemotherapy and the radiation, your body also recovers to fight off that cancer. So that's one. And also, there's less gene damage though on the cells when it comes to HPV-related oropharyngeal cancers as compared to your nicotine or cigarette smoking related cancers. And like what I mentioned earlier, maganda rin yung response ng katawan mo sa chemotherapy and radiation for oropharyngeal HPV-related cancers. Meaning when they give you chemotherapy and radiation treatment, your body recovers fast enough so that the natural regulatory mechanisms to prevent that unregulated multiplication of your cells, nababalik yung regulatory mechanism na yun. So that's what they're looking at. But then is it really definite at this point in time? Wala pa, hindi pa nasasabi. They're just looking at those hypotheses.
Parang ganda explanation nun, ano? Do you routinely test, kunyari, head and neck cancers na kunyari, to differentiate HPV ba to or non-HPV or diba?
Yeah, right now, ma'am, that's a trend, no? But
good.
the past few years, hindi, because one of the problems is the P16 immunohistochemistry, which is stained on the specimens that we get, is not readily available and it's quite expensive. But nowadays, because nga nagiging mas prevalent siya abroad, so now it's mas may access yung mga hospitals to P16 immunohistochemistry. So now we're beginning to test oropharyngeal tumors or even lesions in the oropharynx that we get, and then have this tested by the pathologist.
Wow. Is it available in PGH now?
Yes.
Or do you send? Wow, galing, ano?
Yeah.
Very interesting. Oo.
Yeah.
Anton, you have a question? Yes.
Yeah, for Doc Archie. So, merong ano ba yan? May physical manifestation yung HPV na oropharyngeal section. Parang may warts ba yan inside or outside o what are the...
Some would, yeah. Yung sabi ko, tonsils, hindi pantay yung paglaki ng tonsils, no? Or sa dulo ng dila, may parang warty. No, hindi siya warty, may parang mukhang bukol dun sa area na yon. Then that's the reason why we do biopsies. And then sa biopsy, we send that. Kasi mismo yung specimen ang tinetest kung may HPV, kung reactive siya doon sa P16 stain. So once it reacts to that P16 stain, surrogate marker siya eh. So ma-assume mo na talaga HPV-related tong cancer na to. If it's not a P16 positive, then siya yung regular type of oropharyngeal cancers. So important pa rin that yung detection is one, and then get the biopsy to determine if it's P16 positive. Also, lastly, normally, in most cases, mas malaki yung neck node metastasis compared to the primary tumor in the oropharynx for HPV positive cancers. Unlike dun sa other way around, yung sa smoking and alcohol related, usually malaking yung bukol sa tonsils and hindi ganun kalaki yung neck node metastasis. And it's the other way around for HPV positive oropharyngeal cancers.
Wow, thanks. I have a question naman for Doc Art, and this is medyo parang isa mga taboo questions, no? Kasi this has to do with counseling naman. So let's say kasi urologist, 'di ba? Tapos you have patients who come to you, tapos may genital warts, di syempre sexually transmitted infection. How do you counsel these males who, kasi syempre kunyari they're married, tapos even if their wife or their partner is monogamous, pwede nilang i-pass on yun. And mamaya if the woman catches it, she's at risk for HPV infection, which may lead to cervical cancer. So, how would you advise these male patients who come to you and then, they have this, and minsan kasi babaliwalain di ba? Kasi benign naman yan, di naman cancer.
Good question yan.
Oo, di ba? Paano mo, kasi syempre, dapat kung sarili mo lang, okay lang sa'yo, dapat alam mo na you're passing it on to your partner, di ba? Or how do you advise, how do you counsel these patients?
Ma'am, singit ako. May sisingit ako dyan, Art.
Sige.
Kasi I've had
blackmate and batchmate, di ba?
Yes, ma'am.
Yeah.
Art, may patients ako, or friends ako. Nag-positive yung wife.
Oo.
Pero monogamous yung wife. Asymptomatic si husband. So the wife, kasalanan mo to, ikaw nagbigay sa akin ito. So that's part of how do you address this?
Oo, sino mauna? Kanina ba nang galing, di ba?
Can you imagine the impact on the relationship, di ba? Kaya that's part of yung sinasabi ni Anton na hash-hash. Kaya siya hash-hash Di ba? Kasi syempre pointing fingers yan. Ako wala akong ginagawa. Sa'yo ko nakuha to. Di ba? How do you handle that as doctors? Syempre minsan they will pull you into it. Doc, sabihan mo nga yan. Wala naman akong, alam mo namang ako'y behave tapos sa kanyang galing. Ito naman, wala naman akong nararamdaman. Wala naman akong symptoms. Di ba? Yung mga ganun. How do you address this? Parang as clinicians na nandyan na. Tapos nag-aaway na sila sa harap mo sa clinic.
I always tell patients, lalo na kung yung lalaki lang muna yung pasyente ko and then he came in to, be evaluated for warts na na-detect niya, I always tell him na you have to protect your wife because this is an HPV infection and it's been known to cause cervical cancer. No? It's a very, very burdensome disease na pag mangyari sa wife mo, if you love your wife, it will really break your heart, sabi ko. And then you have to have her vaccinated. Ngayon, there are some occasions nga, nakatulad nung kay Archie, na mag-asawa na yung pupunta sa akin and parang galit na yung misis, no? At sinasabi niya, I'm positive, sabi ng OB ko, ganun. I always explain to them na if, this is not parang telltale sign na there has been infidelity that happened, no? Because the infection could have happened even hindi pa kayo, no? Years ago.
Pwede.
So, pwedeng nangyari yun at that time. So,
very good point.
Yeah, hindi yun sign na it's an infidelity that you confirm because dahil positive ka. So, yan, they have to be very considerate and understanding of each other with regards to these kinds of infection. Pero yun nga, sabi ko nga, cultural talaga tong ating approach sa diseases na to kasi yung burden of having the protection ngayon is just on the women. Itong men, hindi talaga pa recommended. No? You can see it in the guidelines right now sa Pilipinas na
talaga? Wala?
Yeah, hindi. So, every time I attend mga webinars or lectures, actually it's because my wife is an OB-GYN and I'm the driver. So I'm forced to sit down and listen to the lectures. And I was wondering, males are the carriers. Why don't you involve them? You should vaccinate them to prevent this disease from proliferating. No? Pero
it's a good point.
It's cultural. In our culture, may pamacho effect. No? Males are supposed to explore the field before they get married. No? Pack in as much experience as possible. Kaya siguro ganon, no? And then pati yung hindi na discuss yung effects sa males eh. But I hope, sabi nila, before the pandemic started, major vaccine manufacturers were planning to launch a campaign to include males in the vaccination drive. Sana matuloy. Because I think the only way for prevention to be successful is to include all the tawag dyan, people involved. No?
Yes, agree.
Follow-up question.
Maganda pala tandem. No?
Follow-up question lang. So kapag meron ka ng HPV, hindi ka na pwede mag-vaccine. Tama ba?
Pwede pa rin, Sir Anton, because you don't know what kind of type you are infected with. Kaya
Okay.
nga sabi ko, mas maganda yung maraming types, like yung 9-valent. Kung may wart yung patient, inire-recommend ko, there's this vaccine available. It can protect you against 9 types of the viruses. Probably you're infected with just, kung wart lang yan, no? Type 6 and 11. So there's 7 more types that you can be protected against. So pwede pa rin.
Okay.
Madami kasing types ang HPV. Talagang if you, alam mo yung mga warts. Actually, it's a big family. Tapos the genital warts are just a small part of that family. And yung 9-valent na yan, hindi pa nga covered lahat. So even if you get one, if you get a certain type, it can be, vaccines can be protective din, di ba ma? If you happen to get another type, if hindi ka wala kang protection, it affords more protection. Kaya magandang point yon. But magandang point yon kasi talaga, for the longest time, the focus has been on females. Kaya akala nga na minsan ng males, basta, that concept of condom is protective for sexually transmitted diseases, it doesn't follow for HPV. Kasi nga, it's, skin-to-skin contact eh. So akala nila kasi basta mag-condom protective. Hindi, it doesn't work out that way. So we've been talking about the kasi we have just a few minutes left. We've been talking about the males. Let's go to the children, to the husband, the couple. Let's go to the children. What is a good way to bring this up with what's the best way to educate the kids on HPV? Pag kunyari, syempre you're going to bring them to, you want them to have them vaccinated early. How would you bring this up to your teens or your
Good
preteens?
question.
Diba? Ilang taon yan? 12, 14, 16 ang mga anak mo.
Yes.
Diba? How would you, kasi hindi mo naman dadalhin sa clinic, sabi mo lang, measles, mumps, rubella lang yan. Ito, HPV. So, syempre, they ask na what the vaccine is. Or how would you suggest na, at saka pala, pag pedia age, kasi ang pedia is mga up to 18, di ba? Pwede bang diretso na sa'yo, Art? Kunyari, kahit na, urologist, dapat pedio. Oo, okay na yun. Paano mo sasabihin? Paano mo explain how would you educate the kids on HPV? Or what do you think if you had a choice of how to approach it sa schools? Paano kaya? Ayan, si Archie din. Baka si Archie may idea.
Kasi sa culture natin, ang basic culture, taboo ang sex to be discussed at home. So that's one hurdle that we should overcome. No? In my experience, I don't hide anything from my kids. Once they start asking, or once that they're at that, even if they're not asking, once that they're at that age na you think that dapat aware na sila about their sexuality. And that's the time you start talking about their sexuality and then sexual behavior. And then doon mo isisingit naman how to protect themselves. Diba? Even sa daughters natin, dapat we should start discussing that. It starts at home, ma'am. I don't think you can assign that to a doctor to educate your children or even the schools. So it has to be an open discussion at home. How that's gonna happen with our culture, hindi ko alam pa paano. Pero yun, kasi ma'am, pag napag-usapan mo na ang sexual intercourse sa kids, practices, doon mo mapapasok yung sexually transmitted diseases and how to protect themselves.
Anton, how do you plan to do this with your boys?
Hindi, sabi ko nga kailangan siguro ng parang a presentation na pwede i-adapt ng mga parents. Pero kasi we had this another issue kasi HIV, di ba? Nag-increase rin sa Philippines eh. So parang isasama-sama mo na HPV, HIV, and then tama yung ang entrada is sex, no? Parang basic sex education by the parents. I think that's the only way eh. Kasi nobody would discuss it talaga outside eh. And my worry, kasi it's trending already in the US and other countries. Our kids, when nag-face-to-face, college na yan. Babalik lahat ng mga kids ng face-to-face in college. Just imagine, di ba? What will happen? they're all in their sexually active age. So, I mean, I think before we get back to, siguro we have another year pa, di ba? That at least we can discuss to them before we have really face-to-face or mawala yung pandemic. Then at least, this is the time to handle it eh. Sa tingin ko.
Parang 2 years of not seeing each other because of the pandemic.
Oo, di ba?
And with the
Diba?
raging hormones.
Oo, raging hormones.
Oo.
Ma'am, ako medyo,
naipon sa
medyo
bahay.
radical ako, ma'am eh. I would,
sige,
if
sige,
that
Archie.
time comes, I would give
Yeah.
my son and my daughter condoms and it's
Ah,
up to them.
Yun nga eh, ganun di ba? You'll have to
give it to
discuss
them.
that eh.
Kasi
How
kahit
old
ma'am,
are
the
your
reality
kids?
is they're gonna do it at some point in time. So might as well
Yeah.
empower them, make them
How old
make
are
the
your
right
kids?
decisions.
Archie, ilan
One
taon na?
15 and one 7. The 15,
Wow!
okay na ako sa 15 eh.
15 is the boy or the
yes,
girl?
ma'am, the boy.
Ah, boy,
I mean,
oo.
oo.
Naku,
Open
kayo
naman yung
pala.
discussion namin, ma'am.
Oo. Si Art.
My daughters are 16 and 13, and I've talked to them, no? Kasi there's this vaccine na nasa ref namin. Ayaw pang
bigay ni
magpa-inject.
mom
But
eh.
I keep on telling them, have yourself protected because some idiot might infect you.
Ano yan? Vaccine stock ni mommy? Kasi
Yeah, yung
bigay ni
vaccine
wife
ng
mo.
wife ko. Or let me
Okay.
take this opportunity to plug also. My wife,
Yeah.
she's a gyne-oncologist. And she has been nominated by the Catholic Mass Media Awards just a couple of days ago. She did not win, but it's an honor to be nominated
Yes, it is.
for her comics, no? KKK.
Oh, that's good.
Yeah, ano yan? Basta kababaihan pangkalusugang comics which is about protection against cervical cancer. So in order to increase information drive against HPV infection for women, kasi yun nga, mahirap sa atin eh, sino bang mag-explain, no? Gumawa sila ng comics for people to understand
Nice.
ano ba ito
That's
at paano
good.
maprotektahan against it.
Very good. Alam mo, iniisip ko tuloy, Anton, baka yun na mas kailangan pag sa mga bata eh. Comics na approach. Di ba?
Oo, comics approach.
Mas may intindihan.
Pero ako,
Okay.
ang motivation ko lang, just to add, no? Kasi nga, mag-away yan sa mag-asawa later on eh. At least,
True.
pag HPV vaccinated, alam mo na, hindi nanggaling sa mga anak mo, di ba? I mean, at least, di ba? Vaccinated lahat ng mga anak mo against this. Anyway.
Oh, this has been alam mo, ang ganda ng discussion natin. We have time for one more question, and siguro I see a question sa Q&A, no? So before, it's from our anonymous attendee. Ang tanong niya ay, if you are HIV positive, is it also important to get an HPV test? Or that the attendee is asking kung dapat ba siya magpa-HPV test kung HIV positive siya. So, what do you think? HIV positive.
In preparing for this lecture, what I encountered was malignant conversion of HPV infection is very high in immunocompromised individuals. So, mas nagiging cancer yung HPV infection dun sa mga HIV positive. Yun yung nakita ko dun sa mga readings ng up-to-date.
Yeah. Actually, alam nyo, pag HIV, kahit lahat nga, di ba, yung mga STIs, sexually transmitted infections, kasi maraming co-infections dyan eh. So I guess it should be it should be considered, and the patient should also be informed of the risk. So a very 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 exciting discussion, very thought-provoking and at times scary but hopeful. But we have to end the Q&A, and I'd like to thank muna the speakers and our reactor. To wrap things up, today's talk concludes our series of discussions on HPV. Because over the past weeks, we have been introduced to the basics of HPV infection and diseases, particularly among the female and adolescent population. But now, today, we have learned about the public health concerns associated with the growing rate of HPV infection in males. We've learned about its risk factors, manifestations, diagnostic options, treatment, and prevention. We've also learned about how HPV can also affect the head and neck. No, it can be the cause of cancers, and that cancers which are HPV related may have a better prognosis, better treatment. Ganda na explanation kanina ni Doc Archie Y, no? So before we end, we would like to ask our speakers, Doc Art, may we ask for a few points you want our viewers to remember
Yeah.
from this forum? Final
I think
words?
what has been very clear during this time of pandemic is an ounce of prevention is better than a pound of cure. Get vaccinated, behave.
Yeah, very good. And that's very good. Doc Archie, any final words?
And it's just not in, it doesn't happen only in arts field head. It also happens in the head, the true head and neck.
The lower
So-
head and the upper head, no?
Yes, ma'am, both heads. Yeah. So be
Good,
careful
very good.
and have
Yeah.
yourself vaccinated. I agree with that. Yeah.
Well said, well said. And finally, from our guest reactor, Anton.
Yes.
Thank you for all the questions. Very,
Yeah,
very thought
no, thank you
provoking.
for this forum, no? Kasi there's really no other forum. Again, this is a hush-hush topic. So thank you, Doc and Mu Sigma Phi sorority for having this forum. And I think we can take off the discussion from here, how we can protect our kids, most especially.
Okay, thank you, thank you, thank you to all our speakers for giving everyone an informative overview of our topic today. So before we end, we, the Mu webinar team of the Mu Sigma Phi Medical Sorority, would like to express our gratitude to our partners, the UP College of Medicine, the Philippine General Hospital, and the City of Manila. This event would not also be possible with our co-presenters, In Life Sheroes, and the Mu Sigma Phi Foundation, our co-sponsor, Merck Sharp and Doe, and our official media partner, Our Awesome Planet. We are also grateful for the unwavering support of the UP Manila Information Management Systems and UP Manila Postgraduate Institute of Medicine. And most of all, we thank you, our participants, for spending your lunch hour with us. Pasintabi na lang sa mga kumakain nung naglabas kami ng pictures. Again, we remind all healthcare professionals who are interested in obtaining CPD credits to please fill out the evaluation form at tinyurl.com/MuWebinars 2021 eval within 3 days after the forum. You may find the links to the evaluation forms at the comment boxes of Facebook Live, YouTube, and chat box of Zoom. And we would also like to invite you to be with us again on the next leg of Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum on January 11, 2022. That's a Tuesday from 12 to 1 p.m. entitled A Woman's Diet for Better Health, or Ang Wastong Nutrisyon para sa Kababaihan, which will focus on the basics of nutrition and healthy meal planning and the importance of having proper nutrition to good health among pregnant and non-pregnant individuals. For this webinar, we will be having Dr. Mirna Buenaluz Durante, my classmate and sis, and Dr. Sherry Suplido, also my sis, as our speakers. And again, another sis, Dr. Anna York Bondoc, as moderator. And likewise, please support and participate in our year-long Women's Health Forum series. Again, this is Wen Raymundo. Thank you very much and have a good day.
Thank you for attending the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum.
The Mu webinar team of the Mu Sigma Phi Medical Sorority would like to thank our partners, the UP College of Medicine, Philippine General Hospital, and City of Manila. Again, the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum is co-presented by the In Life Sheroes and the Mu Sigma Phi Foundation, and co-sponsored by Merck Sharp and Doe. And this event is covered by our official media partner, Our Awesome Planet. We are also grateful to the UP Manila Information Management Systems and UP Manila Postgraduate Institute of Medicine. Most of all, we thank you, our participants, for spending your lunch hour with us. For those who are interested in obtaining CPD units, please fill out the evaluation form at tinyurl.com/MUwebinars2021 eval. Please ensure that your answers are submitted within 3 days after the webinar. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram. For more details and updates, please check our Facebook page at facebook.com/MUwebinars and our Twitter timeline at twitter.com/MUwebinars. You may also email us at mewebinars2122@gmail.com. Before we end, we would like to invite you to the next leg of the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum on January 11, 2022, Tuesday from 12 to 1 p.m., entitled A Woman's Diet for Better Health, or Ang Wastong Nutrisyon para sa Kababaihan, which will introduce us on the basics of nutrition and its importance among pregnant and non-pregnant individuals. The speakers will be Dr. Mirna Benaluz-Durante and Dr. Sherry Suplido, and to be moderated by Dr. Ana York Bondok. And likewise, we would like to invite you to participate in our year-long Women's Health Forum series. Thank you very much for attending this webinar. Have a good day.